Good day, everyone. Today is Thursday. It is Tell Time Thursday. Didn't get a chance to post for Wednesday, but we're going to try to mix the two. Wednesday is usually what, when, where. So what are we going to talk about? I'm going to mix the two. And I had said that we were going to discuss some ear conditions. And so we're going to mix that with our NGN case study for today. So, Tell Time Thursday is all about case studies and how to understand the 6 NGN skills that you will be tested on for the NCLEX. Case studies tell us a story, a tale about the patient or case event, and we must know how to use the nursing process to develop the plan of care. All right, so I feel like this skill is going to be about action, taking actions. And if you're planning to join the webinar on Saturday, it is free to everyone. All you have to do is just register. When you go into register, I actually should show you how to register. Let me just show you really quick how to register. You want to go, if you don't have the link, and I'll put the link in the comment, but you want to just go to my website basically, which is tnc-travelnursecityandservices.net. That's how you can keep up with any event that is coming up. And this Saturday, we're going to have a virtual event. I'm trying to have them every Saturday. I'm feeling a little bit better, so I'm hoping to be a little more to myself, and maybe my hearing will be a little bit better. But what you do is you just go here and you click on buy tickets. All right, it's going to be March 16th at 7 p.m. That's an Eastern Standard Time. You can scroll down and, see what else it says. It gives you a little bit of a synopsis. And if you go to here, you just want to put in how many tickets, 1 ticket per person, and go to checkout. That's really all you need to do. You don't have to scroll all the way down to the bottom. What I'm finding is a lot of people scroll down here and they put in contact. That's fine if you're interested in setting up a tutor session with me. You can go to contact if I've never met you, or if I don't have any contact information from you, you can go to here. But if I already know you, I'm already meeting with you, I notice people will fill this out 3 and 4 times, and it's kind of a dead end stop, because if I already have your email and have your name and I already know what you're studying, all you're doing is just telling me that 3 and 4 times more. So at that point, you probably just need to schedule your session and get with me for the link to schedule your session. So, but where you want to go is just either scroll down to your ticket, or you can click on buy ticket. It's still going to take you down here. On your phone, same thing. It's going to look pretty much the same. Go to 1 ticket, go to checkout. When you get to checkout, this is kind of the last step. You put your name. You don't have to put your full last name. You could just put an initial. But you do want a good email so that I know where to send you the Zoom link. I'm going to make sure you get the Zoom link, and I'm probably going to invite you to the webinar Google Classroom. Once you hit continue, you should see a thank you. The thank you should also say, here's your ticket. You can download your ticket, and you can add the event to your calendar so you don't forget. Also, you should receive an email at that point saying that you have purchased a ticket. Well, of course, it was free. All right. Now, again, people will get there and they won't hit continue. For some reason, they'll skip that and they'll still go down to this and they'll fill this out again. I've had people do this several times. They'll fill it out again and again. They'll say, I filled out all my information. Nothing happened. There again, this comes to me, but it just tells me that you're interested. You have an interest in tutoring with me. And that's all it tells you. That's all it does. But if you're trying to get into the webinar, go here, continue, and then you should see the thank you. You should have an order number, ticket number, because I will ask you, did you get an order number? Did you get a ticket number? Because I'm always looking to make sure things are working appropriately. So if people are saying they filled it out and they're not on my guest list, I have to make sure there's not any technical problems that are occurring. So far, I haven't seen any technical problems, maybe once or twice, but most of the time it's because people are not getting to this step and hitting continue. They're skipping this and they're going down here. I don't know why, but that's just part of the contact me. And I may even end up revising this when I get ready to revise my site. But that's all that is. All right, so let's get into our study for today. This case study is going to be about ear irrigation and specifically otitis media. So, if you're studying through Saunders, this picture is, I got this one out of the 8th edition, but it is in the ninth. I had to actually type in otitis media and find it in the ninth edition. And they talk about irrigation and ear medication. So, on the ear and eye and ear medication chapter, which is chapter 58, they will explain to you how to instill eardrops. That chapter will also talk about ear irrigation. But otitis media is an inflammatory disorder. It's usually caused by an infection of the middle ear. So far, I don't think I have an infection of the middle ear. Mine is the external portion of my ear. So thank God for that. But it occurs as a result, this infection occurs as a result of a blocked eustachian tube, which prevents normal drainage, and it can be acute or chronic. And I do feel like an external ear infection can turn into an internal. So this is just a picture of an irrigation of the external canal. Stream of water is aimed above or below the impaction. You want to allow back pressure to push it out, to push out the cerumen, which is just basically earwax. And you don't want to push it farther down the canal. You also don't want to aim the irrigation syringe directly at the eardrum. All right, let's look at this picture. Also comes from Saunders. This more so talks about hearing. So if you're interested in looking at what does it mean to have conductive versus sensory neural hearing loss, they explain that in here. Um, and let's see, I was trying to see if we had a good picture of the eustachian tubes. But when that portion gets blocked, that's when patients have problems, because your ear needs to be able to drain, and that's where I'm getting kind of worried about on my ear, because I'm putting eardrops in, but I can tell it's blocked, and I can't really hear out of my left ear. There's burning in my left ear, and the pain has gotten a little bit better, but there is a lot of pressure. It feels like I can hear my heartbeat in my ear. But the eustachian tube is also called the auditory tube. It is the tube that links, kind of links us with our pharynx structure in our body. It extends from the middle ear to the upper part of your throat. So yeah, it does. It connects us with our throat just behind the nose. That's the eustachian tube. It is maybe about 3 millimeters, 35 millimeters long, and 3 millimeters in diameter for adults. The first portion of the tube that's closest to the middle ear is made of bone, and the remaining part is closer to your nose and throat, and that's mostly fibrocartilage. It's tough, flexible cartilage. And the purpose of your eustachian tube is to drain excess fluid and secretions from your ear, and it helps to equalize pressure. So I can tell I have a lot of pressure in my ear. It ventilates your middle ear, and it equalizes air pressure on either side of your eardrum. So it also acts as a barrier, and it protects your ear from getting microorganisms in it that can cause a middle ear infection. So that's kind of the purpose of it. But here they just tell us that little tube portion here that connects with the nasal pharynx to drain things out. This is the eustachian tube. This is the bony portion, and then it becomes a cartilaginous portion to drain things out. So if that doesn't drain well, if it gets blocked, an infection of the middle ear can happen. But mine so far, I think, is really down in here. That's where it really itches a lot and burns and hurts. All right. So that's what we want to know about otitis media, to understand how it occurs. And if you're a visual person, you want to be able to look at pictures of things when you're studying, so that you can understand the process and understand what's happening. Now, what is the most common complication or cause of otitis media? Well, it's a common complication of an acute respiratory infection. Commonly, it can be RSV, which has been going around through the winter. Now we're getting ready for spring. But influenza, group A strep, it's common for infants and children. Their eustachian tubes are a little shorter and wider and straighter, and it makes them more prone to otitis media. Ways to prevent it is to make sure that the babies are being fed upright to prevent reflux. You want to make sure they're getting immunized. And an assessment would be fever, onset of ear pain. Maybe the child is crying, they're irritable, they're lethargic, they've lost their appetite, rolling of their head from side to side, pulling on or rubbing their ear, purulent ear drainage may be present. There may be some signs of hearing loss, red, opaque, bulging, immobile tympanic membrane on an otoscopic examination. So when they actually look into the ear, they'll notice that. All right. Okay. Let's get into the question. We got a lot of information. So your test tip when you're dealing with case studies, I always recommend go to your question first and just understand what you're looking for. And so we're going to talk about the answer to this tomorrow. I'm going to combine Nurse News Friday, Fun Fact Friday, and with a little nursing news with the answers to this. So we'll give you today to kind of look over it and see what you think the answer is. Which instruction should the nurse instruct the caregiver when demonstrating the installation of the OTIC prescription for the client? So OTIC, you want to know that that term deals with the ear. All right, OTIC, not optic, but OTIC. All right, so that's dealing with the ear. So they're got to instill some medication into the ear. So that is a action. How do you take action? How do you perform ear drop installation, and what things are important to do and to keep in mind in order to put in those ear drops? What do we want to do? All right, so you can look through those options and start pulling out trigger words or anything that you see could be kind of questionable or things that you need to think about as you're reading these options. And this is a select all that apply. Which instruction? So it tells me there's probably more than one. Instruct the client to remain in the same position for 5 minutes after they put in the medication. Okay, that's a good point. Do I want them walking around and moving around right after you put that eardrop in? Is it going to stay in if they're moving around? Good point. Gently press the tragus after administering the medication. All right, now you want to know, what is that tragus? This is the tragus here. Do you put pressure there? Because you're going to instill that eardrop, and do you put pressure? Gently, should you gently press? And I like that word, gently. We want to know where the tragus is after you administer the medication. Is that going to help the medicine stay in? Is that good to do? What does that do? All right, so that's a good point. Pack the ear canal tightly. Here's another strong word. You want to be able to pick out strategic words that might trigger you to say eliminate or keep the option, or eliminate that option. Do we tightly pack it with cotton after administering the medication? I can tell you right now, I cannot tightly pack anything into my ear. It's going to hurt too bad. So I can tell you that. Instruct the client to remain in the same position. So this was same position, or should we have them moving around after the med is given? All right, now how do you pull the earlobe? Do you go up? Do you go down? Do you go back? Do you pull the lower earlobe down and back prior to administering the medication so that you can get the eardrop in there correctly? This is all age-based. So we want to know the age of this patient so we can determine whether down and back is appropriate. Should it be up and back or down and back? Irrigate. All right. Should we clean out that ear? Irrigation means you're going to clean something. Should we irrigate the ear if cerumen is present before? Do you want to irrigate it before? Do you want to irrigate it after? Should we irrigate it before instilling the medication? I can tell you now, my ear definitely needs irrigation, but there's a lot of pain, and I'm a little afraid of what's going to happen today. I'm like, I want it cleaned out because I believe I'll be able to hear better, but I'm just worried. I'm going to make sure I let them know there's a lot of pain in there. I don't know if I can take the pain, but I know it needs cleaning out. Keep the medication refrigerated until use. So we want to see what is the medicine, and should eardrops be kept in the refrigerator? Do you want to give eardrops into a patient cold? So a lot of good things to keep in mind here. Refrigeration. All right, so we got a good thought on the types of answers that we can choose or eliminate. Now we just have to see what's going on with the patient so we can more directly answer this. All right. So keep your notes for tomorrow. Again, this is a pediatric patient, so that helps us to figure out what are we going to do. Patient has otitis media. They are 4 years old, so that should help you when answering, should you go up and back, down and back? Which one is it? All right, their four-year-old male client brought to the clinic, ear pain, benign medical history, no known allergies. 10 a.m., the client is alert and oriented, states my ears hurt. So that is a sign of something's going on in their ear. They do have some drainage. Rhinorrhea is drainage from the nose. Ooh, it's green. This is an infection. Bilateral tympanic membranes observed to be bulging. So the tympanic membrane is the eardrum. It's bulging. It's red. There's yellow drainage. Sounds like this is down into the middle ear, because remember that picture that we looked at of the middle ear portion. When an infection gets down in there, that's including this area, which is from here to here. That's your middle ear. So that's including the tympanic membrane. All right. What else do we know? The caregiver states he, which is the client, the child, has not been feeling good the past few days and last night, and he kept waking up saying his ears hurt. Sounds like me, could not sleep for 4 or 5 days. Heart, S1, S2, no issues there. Regular rhythm, 3+ peripheral pulses. Skin is warm and dry. Bilateral breath sounds, clear to auscultation. Bowel sounds are normal. They do have pain. The Wong-Baker Faces scale is what you would be a good scale to use for kids, because they may not be able to tell you on a scale of 1 to 10, but you can scale it based upon how their presentation is. You know, do they really look sad? Or are they crying? You know, so they give them a 6. Plan to administer first dose of the prescription during caregiver education. So that's our nurse's notes. We got some vitals. Oh, yeah, they're running a fever. Infection. Heart rate's 112, breathing 28, blood pressure 96/52, pulse ox 100% on room air. This is a part where you want to know what are vital signs, what are the normal vitals for a pediatric child. All right, so we'll talk about that tomorrow, but you have today to kind of look up how are you going to remember if these vitals are normal or not. You want to have a system. All right, here's the medicine, ofloxacin, 0.3% solution. They're going to instill it for 7 days. Oh, they got to put in 5 drops. I only had to do 3 drops, 10 days. They're going to do 5 drops in each ear once a day for 7 days. My medicine was just not an antibiotic. It also has like a steroid in there to decrease inflammation. Sometimes that helps with itching as well. All right, so we have our question. We have our information. And I think that is it. Yeah, that's it. All right, so here's your question. So we're going to answer this tomorrow. What things do you think we should teach? So basically, these are nursing actions. What would you do for the child? If you're going to instill eardrops into this child, what would you do? And then whatever you would do, what would you instruct that caregiver to do? It's probably going to be about the same thing when demonstrating the installation of the OTITIS prescription for the client. Remember, this is a 4-year-old child. All right, so use your strategies. We talked a little bit about it. Figure out your keywords, highlight those words, things that you want to eliminate. If you're looking in Saunders about irrigation and eardrops, again, those are chapter 57 and 58 in the 9th edition on eye and ear problems. It's a good chapter to review. And we'll come back tomorrow to review this case study. And today we're going to talk about, tomorrow we're going to talk about take actions. Take actions, you have to really know what to do. How do we fix the problem, prevent any problems, help the patient? What are we going to do as we take these actions to instill the eardrops? You want to know the correct, proper way to do it. All right, have a wonderful day, guys. I'm going to get ready for my appointment, start getting ready early, and hope you have a wonderful day, and we'll talk about this one tomorrow.